All right, so get this. Today we're going deep into the world of psychopaths.
Oh, it's always a fun one.
Yeah, and to guide us, we have the work of Dr. Guido Palomba.
Oh, wow. A renowned Brazilian forensic psychiatrist.
He's not just an expert. He's spent decades working with psychopaths,
Wow.
getting a chillingly up-close look at their minds.
So he's like really seen it all, huh?
Exactly. And that's what makes his insights so fascinating.
So what's one of the things that stood out to you from his work?
Well, right off the bat, he uses the term conduitopaths instead of psychopaths.
Conduitopaths. I've never heard that before.
Right. It's not just semantics, though. He's getting at something crucial about how these individuals operate.
Okay, I'm intrigued. Tell me more.
It's all about their conduct, their actions. You see, that's where the pathology really lies.
Okay, so it's not so much about their thoughts or feelings, but more about what they actually do.
Exactly. He's drawing a distinction between conduitopaths and people who are traditionally considered mentally ill.
So how does that work? I mean, how is that different?
Well, think about it this way. Someone with a mental illness, like schizophrenia, might experience hallucinations or have a break from reality.
Right, right.
Conduitopaths, on the other hand, are firmly grounded in reality. They just experience it differently.
So they're not detached from reality, but maybe detached from certain emotions.
Got it. I'm thinking about the classic image of the cold, calculating psychopath.
Yeah, the one who could like stare you down with no remorse.
Exactly. Is that what we're talking about here?
It seems like Dr. Palomba talks about how conduitopaths lack what he calls higher level emotions.
Higher level emotions. What's that?
Things like pity, compassion, altruism. These are the emotions that allow us to connect with others on a deeper level.
To understand their feelings and act accordingly.
Right. Without them, you're left with a very self-centered, egotistical worldview.
Which explains why it's so hard to wrap our heads around their actions, right?
Yeah, it's like trying to understand a completely different species.
Exactly. They just don't seem to grasp the emotional weight of what they do.
And Dr. Palomba shared some pretty telling anecdotes about this.
Really? Like what?
He described asking conduitopaths if they felt remorse or regret for their actions. Their responses are chilling. They often blame the victim, the circumstances, anyone but themselves.
It's all about deflecting responsibility.
Exactly.
It's like their empathy button is just broken.
Yeah, and that makes it really difficult to treat or rehabilitate them.
So how does someone like Dr. Palomba, who clearly has empathy in spades, even begin to work with these individuals?
Right. I mean, I can't imagine it's easy to sit across from someone who seems to lack such a fundamental human quality.
It's got to be tough.
It is. And Dr. Palomba doesn't sugarcoat it. He talks about how challenging it can be, particularly when dealing with individuals like the subject of one of his most famous case studies, the monster of the Trianon.
Wait, the monster of the Trianon. I've heard that name before. It sounds like something straight out of a horror movie.
It does, and the reality isn't far off. This particular individual was completely uncooperative during their first meeting. Yeah, controlling the conversation, dictating the terms. Dr. Palomba was basically walking into a lion's den.
Wow, that had to be unnerving, to say the least. So how did he turn things around?
Well, this is where it gets really interesting. Dr. Palomba used a tactic he learned from a mentor, a way of establishing dominance in the interaction.
Okay.
He described it as the wolf doesn't eat wolf concept. You see, he realized that to get anywhere with this individual, he couldn't back down.
He couldn't show weakness.
Right.
So it's almost like he had to meet this monster on his own level, using his own tactics against him.
In a sense, yes. And it worked. By shifting the power dynamic, Dr. Palomba got the subject to reveal more about his crimes, which were truly horrific.
Oh, man, I bet.
And here's where that chilling lack of remorse really comes through. The subject actually blamed his victim for their own death.
Wow, I don't even know what to say to that. It's hard to fathom that level of detachment.
It is. And that case really speaks to something else. Dr. Palomba emphasizes conduitopaths have desires that are considered abnormal, both in their intensity and their focus.
Okay, I'm really curious about this. What exactly does he mean by abnormal desires? Can you give me an example?
He doesn't go into specifics, but he talks about how conduitopaths lack the same ethical and moral framework that most of us have.
Okay.
This allows them to act on their desires without the same restraints, and those desires often revolve around power and control.
Oh, I see.
It's no coincidence that they're often drawn to positions of authority, whether it's within a criminal organization or even legitimate leadership roles.
So what you're saying is that these individuals might be drawn to places where they can wield influence over others, exploit them, and get what they want.
Exactly.
That's scary.
And because they're often able to blend in seamlessly, they can be incredibly dangerous. They put on this mask of normalcy, appearing charming and charismatic on the surface.
But underneath it all,
They're driven by this cold, calculating desire to manipulate and control.
that's a really unsettling thought. It makes you wonder, are these tendencies something they're born with, or are they shaped by their environment? I mean, is there any hope for change?
That's a question a lot of people have, but Dr. Palomba is very clear on this. He believes conductopathy is a lifelong condition, not a phase or a result of trauma.
So he's saying there's no treatment, no cure.
Yeah.
That's a lot to process. It paints a very bleak picture, especially for those who are affected by their actions.
Yeah, it definitely raises a lot of questions about how we deal with these individuals in society.
Yeah, it really does, especially when you think about the justice system.
Oh, right. How do we deal with people who might be a threat but can't really be cured?
Exactly. It's a real dilemma.
It is, and Dr. Palomba really wrestles with this in his work. He talks about finding a more nuanced approach,
Like what kind of approach?
one that considers the specific risks each person poses, you know?
So not just a one-size-fits-all solution.
Right. It's not about being overly harsh, but it's also about protecting society, you know?
It's a tough balance to strike, for
Yeah.
sure. But, this whole topic, it reminds me of something else Dr. Palumba talked about.
What's that?
The public's fascination with psychopaths.
Oh, yeah, that's a big one. We see it everywhere. Movies, TV shows, books.
It's like we're drawn to their dark side, their ability to manipulate and control.
Right, but we forget that the real-world consequences are serious, you know?
Yeah, there's nothing glamorous about the harm they cause.
And Dr. Palumba makes a great point about how this portrayal in media contributes to a kind of glamorization of psychopathy.
It's like we start to see these fictional characters as almost heroic.
Yeah, and it can blind us to the very real danger they pose.
So how do we reconcile this fascination with reality?
Yeah.
How do we separate the entertainment from the actual threat?
Well, I think it starts with education. We need to be more aware of the signs, the tactics.
The tactics they use to manipulate.
Right, and we need to understand the difference between a fictional character and a real person who might be dangerous.
So what can we do to protect ourselves in our everyday lives? I mean, we can't all become forensic psychiatrists.
We don't have to. Dr. Palumba talks about a few key things to watch out for.
Like?
A consistent lack of empathy. A tendency to exploit others, a disregard for rules and boundaries.
So those are all red flags.
Yeah.
What about that mask of normalcy you mentioned earlier? How do we see through that?
It's not easy, but it's about looking past the surface charm,
Looking past the charm.
Pay attention to inconsistencies, to moments when their true nature slips through.
So it's like we need to be a bit more like detectives in our own lives.
Yeah. Observing, analyzing, looking for clues.
But how do we do that without becoming paranoid or distrustful of everyone?
That's a good point, and it's about finding a balance. We don't need to be suspicious of everyone, but we can be more discerning.
Okay.
Trust your instincts. If someone's behavior makes you uncomfortable or unsafe, it's okay to step back.
So it's about being cautious, but not letting fear take over.
Exactly. It's about being empowered with knowledge so we can make good choices.
And protect ourselves.
Right.
This all brings us back to the monster of the Trianon case. It's a stark reminder of how these tendencies can be truly dangerous.
It is the way he manipulated things, controlled the narrative. It's chilling.
It really is.
And it shows something Dr. Palumba talks about, how they often see their crimes as a reflection of their own cleverness.
It's almost like they're proud of their ability to deceive and outsmart others.
Yeah, it's like they're playing a game and we're the pawns.
They're playing to win no matter the cost.
Exactly.
Which is why understanding their tactics is so important.
Yeah.
We need to be able to see through their facade.
Remember, Dr. Palumba said their crimes are like photographs of their behavior. They reveal who they are.
Even if they try to hide it.
Exactly.
So with all this knowledge, what can we do to apply it to our own lives?
Become more aware, pay attention to how people act. Learn to trust your gut feeling.
Okay, so sharpening our instincts, becoming more attuned to the world around us.
Right. But is there anything else we can do besides always being on high alert?
That's a good question.
Well, we can educate ourselves. The more we understand about conductopathy, the better we can identify and avoid danger.
So being proactive, not reactive.
Exactly, taking control of our own safety.
This deep dive isn't meant to scare anyone. It's about empowering us.
That's right. It's about understanding this dark side of human nature so we can be more aware, more resilient.
It's about creating a safer, more informed society.
Exactly. We all have a role to play in protecting ourselves and each other.
So where do we go from here? What's the next step in this journey?
Well, there's always more to learn. We could dig deeper into the research, explore different theories about where conductopathy comes from.
It feels like we're just scratching the surface.
We are, and that's what makes it so fascinating, so challenging, and so important.
It is fascinating.
Yeah.
But kind of overwhelming, too.
You know, right? We've covered so much.
It feels like we've only just started to untangle this whole thing.
Well, and remember one thing Dr. Palomba said?
What's that?
Conduitopathy. It's a spectrum, you know?
Oh, right. Not every conduitopath is like a violent criminal.
Exactly, like the guy in the Trianon case.
Right. Not every one of them is a monster.
Some of them function in society just fine.
He even said some are in positions of power.
It's true, and it's why we need to understand the nuances.
Yeah, we can't just label everyone who has a few of these traits.
Exactly. It's way more complicated than that.
And like you said before, we can't be playing armchair psychologist.
No way. A diagnosis takes a lot of work.
A thorough examination,
Hmm.
their history, their behavior over time.
Right, it's not something to mess around with.
So how do we use this knowledge day to day? I mean, it's impossible to know for sure who we're dealing with.
That's true, but I think being aware, being observant, trusting our gut,
Okay.
those are good starting points.
If someone's behavior is setting off alarm bells,
Or we feel manipulated, unsafe, you know.
then we got to protect ourselves.
Exactly. Set boundaries. Be assertive.
Don't be afraid to walk away.
Yeah.
It's hard, though. Sometimes you think, I should have seen that coming.
I know. It's easy to blame yourself.
Like I was so naive.
But listen, it's not your fault if someone's really good at hiding who they are.
It doesn't mean we're foolish.
No, it means we're human.
And we can learn from these experiences, right?
Exactly.
So maybe that's the big takeaway here.
What do you mean?
This renewed awareness, this commitment to protecting ourselves.
And a deeper understanding of just how complex people are.
We went to some dark places today,
For sure.
but we came out with more knowledge.
That's a powerful thing.
We can't control what others do,
True.
but we can control how we respond.
We can choose to be informed. Be careful, put our well-being first.
So let's wrap this up on a positive note.
Okay.
We explored a tough topic,
We did.
but we're leaving with more awareness.
And that's powerful.
And remember, even with all the bad stuff,
there's still good out there.
let's focus on the good.
Build relationships based on trust and empathy, you know?
Be the light in the darkness.
Exactly.
Beautifully said. Keep learning, keep asking questions, and keep striving for a better world.
A world with more understanding, more compassion.
Until next time.